Regarding nightclubs, it sounds as if perhaps nightclubs are using some loophole to stay open, and maybe you're looking at closing those. Can you give us more insight on what's going on with nightclubs?
Well, a key component is that nightclubs should be closed. We know that transmission is higher in those types of social gathering settings, which nightclubs cultivate. Any locality that has a bar needs to be following the rules that we have in place for bars. And it's really having the public understand, from a shared responsibility standpoint, avoiding crowded places where people are coming together, unmasked, closer than 6 feet, not washing their hands, is critical to protect yourself and your loved ones and stopping transmission of COVID-19.
Governor, there's a situation with the North Providence schools at the beginning of the week where there seemed to be some kind of miscommunication and a back and forth over who called who. But at a minimum, it seems like, at best, messages were left. Are you looking at that? Does there need to be a better system of notifying schools and making sure either a kid who's sick or was a contact doesn't go to school?
Yes. Yes, we are looking at it, and yes, we're looking to improve. The superintendent said, and I appreciate it, that overall the response from the Department of Health in the past month has been excellent. So that's a good news. But in this instance, it could have been better. So we're going through in some detail to figure out, okay, how could have we improved that process? Maybe we should all have incorporated cell phones. Maybe, so short answer is, we're trying to get better. We will get better. We've only been at it for a month. And we're digging into the process to figure out how to make sure that won't happen again.
And if I could just follow up on the schools, I know you made the case today that since a majority of the cases have been in kids and staff who are at home for virtual learning, that schools are safe. I'm guessing some people may see that and say, well, if those people are home, they're not hurting anybody, so why not move more people home? I know there's still a vocal group of teachers on social media, particularly in Providence, who still want to push to more remote learning because of staffing shortages, cases in schools, PPE, cleaning, and stuff like that.
So I would say the reason to believe it's safe to go to school is because we've been at it now for a month. The majority of kids are in school. And we haven't had outbreaks. We're not seeing spread in schools. The testing's working. The contact tracing's working. We've seen cases. We will continue to see cases, but we've limited the spread of the cases. Like I said, in most cases, it's been 1 case per school. So that's, the reason. I think in Providence, for example, in the lower schools, they have a cleaning person on every floor of every school. So we're pretty serious about cleaning and keeping people safe. Also, to answer your question, I don't think that's true. Like, the fact that the children are getting sick at a higher rate tells you they're not staying at home. They are doing what people do. They go to the grocery store, they go to the park, maybe they're playing sports. Maybe they're, I don't know, doing whatever they're doing to get infected, and then they're spreading that infection to everyone else. So I don't think that follows the logic that you were suggesting.
Governor, President Donald Trump yesterday called off the conversations with, or negotiations with Congress about a further stimulus package, and now, today, is calling for what the Democratic leadership calls a piecemeal approach of maybe just stimulus checks. What's your take on all of this, and where does this leave the state in its financial picture?
Yeah.
And I have a follow-up.
So I did see that. It was off, it was on, it was off. Stock market futures went down, so it was back on again. My message to President Trump is we need some certainty. Just tell us. Anyone in business will tell you that. Just give us some predictability. I'll tell you, Rhode Island needs a stimulus. If we don't get a stimulus, it's going to be awful. Layoffs like we've never seen in public service, cuts to health care, cuts to education, horrible choices that nobody, including myself, wants to make. So I'm crystal clear about that. Our federal delegation, just this week, I've talked to Senator Reid, I've talked to Congressman Cicilline, they're on it. But the message to the president is, do something and give us some predictability. So what am I doing right now? What we are doing is we're making scenario plans for every eventuality. How are we going to balance the budget if we get no more stimulus? How are we going to balance the budget if we just get flexibility with the existing money we have? And all the different variations. But the bottom line is, come on, like, do your job, be serious, give us some certainty, give us some predictability, send us a stimulus, let us know how much, so we can get to the serious work of planning Rhode Island's budget.
You opened by saying that Rhode Island has returned to 90, I believe you said 90%
That's
of
right.
it. How do you figure that? How do you arrive at that?
I think it's that composite measure that Moody's has used, where they look across GDP, jobs, job creation, unemployment, and it's about 90%. Obviously, it is not 90% in retail, hospitality, accommodation, but in every other, there's a lot of businesses that are at 100 or 100+%.
What do you tell those people who are in those sectors that are far from recovery?
Yeah, I tell them, hang on to get through this. If you're a restaurant, this is about survival. Apply for Take It Outside grant, apply for Restore Our Eye grant, apply for unemployment insurance. And I'm doing everything I can to get as much of these, keep as much of the economy open as possible.
And if I might...
I also would say this, please. If you're out of work and you're worried that your job might not come back, if you're a cashier who worked at a big retailer and you've been furloughed and you're getting nervous that that retailer just, might not take you back, go to the Back to Work website, get some job training, and let's get you a new job.
And if I might, we've had calls to some of our talk shows, people saying they're getting pressured to repay some of these loans that they've taken. Are you aware of this?
I'm not.
I don't know the specific instance.
I'll follow up with you. I'm not.
Yeah, I don't...
Those are earlier bridge loans, not the Restore Our Eye grant that's happening now.
But I'll look into it, Steve. I don't know.
Thank you.
So, Governor, what is, I feel like we've had this conversation since, June, where, all right, we'll see in a month, hopefully the stimulus is going to come in at the end of July, and so on and so forth. Now we're heading into the winter. You mentioned nightclubs, Doctor, and I know that there's a lot of music clubs that have done what they can outdoors, and there's restaurants now. Downtown, they're packing up blankets today. The Rhode Island Hospitality Association trying to encourage people to go to restaurants and eat outdoors with blankets. But we've got to be coming to a head with all of this as the cold weather comes. So if there is no additional stimulus, will you release CARES Fund dollars to these businesses ahead of the winter? Is that something that from their, so they have some kind of predictability?
I thought you were going to a different place. Maybe. However, again, I'm as frustrated as you. This is why I just wish the Trump administration would just give us some certainty. Let me know what I have to deal with so we can get to work. If there's no stimulus, but if we're allowed to use our existing funds to make up for the fact that our revenue is so far down, then I think, of course, I'm going to work with the legislature, and we're going back into session in November to try to do this work. But then I think you have to say, use some of the stimulus to prevent cuts to health care, cuts to health care access, cuts to mental health, cuts to education, and also possibly giving more money to businesses. So my answer is, which is not satisfying for you, is yes, I am open to doing that. I think it could be helpful. I know these businesses, hotels, B&Bs, restaurants are getting crushed. I'm just waiting for a little more certainty. But anyway, we're coming back in November to balance a budget, and we'll make those decisions then.
So it
Governor,
really comes down to the budget being assessed and,
Yes.
and understanding if the CARES dollars can be put
What
into
they
the
can
budget.
be used for. Exactly.
And if I may, just on substitute teachers, I talked to a couple of teachers this week that said that they're being pressured by their administrators to work regardless, obviously not if they're sick, but to not use the personal days or sick time they're entitled to, that the numbers are that low. There's one district that said they literally have 0 people on their list. Aside from civic engagement, pride, whatever it may be. What motivation, because look, $85 is not a ton of motivation for someone to become a substitute teacher. Is it really just that?
Yeah.
Stepping up World War II
I
style?
think so. I mean, that's why people go into public service and teaching in the first place, which is they love kids and they want to do something good in the world. This is a once-in-a-100-year crisis. It's a pandemic. These kids are going to be left behind for life. By the way, these poor teachers, as you say, they're working their tail off and there's no one on the sub list. So, yeah, maybe it's $100 a day, which isn't a ton of money. It's, I think in Providence, closer to 150. I don't think anyone really goes into teaching for the money. They go into teaching because they love children. So it's a crisis. Lots of people are making sacrifices. Every day I hear of beautiful stories of people making sacrifices. Step up and serve at a time that we need you. But that's the answer.
Governor, the cases per capita is nearing the red line. What steps do you take if it reaches it?
Such a good question. I will answer that, and then I'm going to let the doctor answer that. You mean for schools? Is that what you're talking about?
No, the bottom line of the three on the dashboard.
Okay, that red line. I've got a lot of red lines in my life. We're trying to figure it out. The answer is it depends on what the rest of the data looks like. So, and that was what I was trying to express, perhaps poorly. If you're testing 10,000 people a day, and you have a test positivity of 1.3, 1.4, 1.5%, it isn't particularly alarming that you're at 100 cases per 100,000, because we're testing so much. And the reality is, when you test more, you find more cases. And on top of that, Paul, we're testing in places like Pawtucket, Providence, Central Falls, where we know we're going to find cases. So chances are, if we get to 100 per 100,000, which is the red line, but we're not dealing with mass outbreaks, the test positivity is well below 2%, hospitalizations are still trending down, we're probably not going to do much. But if we start to see some other challenges, then we might do something more.
Governor, the cases,
Right?
the more cases because of more testing is the logic that a lot of people got on President Trump for a couple months ago. I mean, it does show that more people are sick. And, one of the criticisms, too, has been that Rhode Island is using a positivity rate calculation that is different than other places are using. That Rhode Island is retesting a lot of the same people over and over, and an overwhelming majority of the tests are the same people. And if you just look at the new tests and the new positives, the rate is higher. Is the picture not as good compared to other states than is being presented?
So I can see the doctor chomping at the bit because she spent a huge amount of time on this, but I will say we report the data in both ways. We report it in the way other states do and the way that we do. And by both metrics, we are testing more per capita than pretty much anywhere except I think Massachusetts, and testing strategically. So for me, when I look at all the data, no matter how you slice it, that 1.5%, 1.3%, 2% in schools, it's a stable place to be.
The only piece that I would add to what the governor so accurately shared for both questions is that we are looking very pinpointedly at specific groups of cases. What we're saying is disaggregating them and looking at what's our percent positivity when we look at just colleges and universities. What's our percent positivities when we look at congregate care settings? And then how about those other cases that don't have K through 12 congregate care settings or colleges and universities? What are we seeing among those cases where there are local outbreaks? We are having very deliberate discussions between our data teams and the teams who can intervene on a daily basis to be able to go into our more densely populated communities and make a change, increase testing, make sure that people are getting into quarantine and isolation better, or intervene in our manufacturing companies where we are seeing a cluster, making sure that they have the systems in place that are needed. That approach is necessary as we're looking at cases, and it contributes to the increase in testing, and it contributes to how we are evaluating that increase. It's not just across the board. We're going in specific groups in a detailed way to understand how we can have a pinpointed, targeted response to each of the different outcomes that we're seeing in terms of cases.
Doctor, could you elaborate on vaccine distribution, what that would look like, the challenges? Do you expect there to be a significant challenge when it comes to skepticism from the public regarding the vaccine?
Yeah, it's an important reason why we pulled together such a robust, expert, informed subcommittee. Because this is going to be a critical approach. And we've been planning for this for weeks, if not months, because of that understanding. We need to make sure that we have the data and the science to inform what people need to know about the vaccine. We need to be clear on how we are supporting the groups that most need the vaccine. And we need to have a targeted approach to messaging because we understand the skepticism, the distractions, the messaging out there that can pull away from the facts and the data. And that's why coming back here for the Rhode Island information is key, because that's what we are going to stay strong on, the data, the science, and make sure that the people who most need the vaccine are the ones that we're focusing on how to message to them and make sure that they have the information they need to make correct choices.
Doctor, in weighing all of that, is there something specific to Rhode Island that you'll be looking at in determining the safety and the efficacy of the vaccine?
Well, one is what the governor mentioned in terms of building on the strong vaccine program that we have had in the state for years. That's a credit to our schools and school nurses, and a credit to our primary care providers, and a credit to our immunization program and all of the partners across the state. That's the foundation that we're going to base this on. That absolutely gives us a head start compared to other states. We're one of the few states that has a vaccine registry for children, and we've recently expanded to adults. We're not starting from scratch when it comes to that. So that's going to be the Rhode Island specific angle. We also have plenty of lessons learned from H1N1, which I had the honor of being involved in, as with many from across the state. We're going to build on that and be as successful as we can in reaching our goals.
Last question, Pat.
Governor Raimondo, in successive weeks now, there's been significant court cases handed down, both in Pennsylvania and Michigan. And while much attention was paid to Governor Whitmer's issues in Michigan, what's more intriguing, quite frankly, is the court case in Pennsylvania, where a federal court, not a state court, ruled that the congregate gathering limits imposed by defendants' mitigation orders violate the right of assembly enshrined in the First Amendment, that the stay-at-home business closure components of defendants' orders violate the due process clause of the 14th Amendment, and that the business closure components of the defendant violate the equal protection clause of the 14th Amendment. The judge, in his decision, went on to say that the basic liberties of the people cannot be subordinated to open-ended emergency measures. Given the weight that federal court has, as opposed to, say, in Michigan, where it was really a shot at a very well-defined state law, are you concerned going forward, particularly in the potential for a second wave, that your closure orders will have to be limited by this federal court decision?
No. That's not in our district. All of my decisions have been time limited, 30 days at a time, based upon the facts at that time, have all been evaluated at the end of 30 days and adjusted accordingly. Also, hopefully, we don't have to do another lockdown, because now we we know what we're doing. You know, when I did the last lockdown, we didn't know how to test. We didn't know what contact tracing was. We didn't know really, we didn't have any of these systems. So, no, I am not concerned.
Well, I think, Judge, in terms of the decision, was not so much looking at the state's, your case, your administration's ability to respond. I think that's not an issue. The issue is in a second wave caused by, shall we say, the natural progression of the virus, in a wintertime condition. And is the court going to look at these constant 30-day orders as really, in the eyes of a defendant, an artifice?
I don't think so. It's a balancing act, right? It's a balancing test. Certainly I take people's civil liberties and freedoms incredibly seriously. This is nothing you ever want to do, ever. I would open every business tomorrow if I could. Having said that, this is a matter of life and death. So it's a balancing act. You have to balance the interest of public health and saving lives with our freedoms. And to me, these have not been, they're difficult calls, but that's why we do it for 30 days at a time, reevaluate, look at the health condition, and do that balancing act of business restriction, freedom restriction with life-saving measures. Again, as I say, look, you never say never, and I do think there'll be a second wave and the winter will be hard and we're going to have the flu, but we are so much better prepared than we were that I really will do everything I can to avoid another lockdown and closure, because it's a serious thing. You're right, and it does limit people's ability to live their life and do their business.